King is a 55 years old obese man. He was a nuclear power plant worker. Sometimes he felt unwell when working in the station. He felt bone pain, shortness of breath, and dizziness, abdominal pain and vomiting, and frequent urination. So one day, King decided to call his girlfriend to tell her about his condition.
Hello baby, where are you now? I'm in pain. I need to go to the hospital. Can you accompany me?
What's with you, baby? Oh my god. Okay, I'm coming for you. Yeah.
In the hospital, Dr. Christine suggested King to do some tests in order to confirm the diagnosis of the disease. It's information time! Various blood tests are conducted to diagnose myeloma. The first one is beta-2 microglobulin. High levels of it mean the disease is more advanced and may be a worse prognosis. The second type of blood test is complete blood count. It measures the level of red cells, white cells, and platelets in the blood. Too many myeloma cells in the bone marrow will cause some of these blood cell levels to be low. The third type is electrophoresis. There are two types of electrophoresis. The first one is SPEP, to measure the immunoglobulins in the blood and can find a monoclonal immunoglobulin. The second type is immunoelectrophoresis. It is to determine the exact type of abnormal antibody. Finding a monoclonal immunoglobulin in the blood may be the first step in diagnosing multiple myeloma. The next one is free light chain assay, to measure the amount of light chains in the blood, being a possible sign of myeloma. And the last one is blood chemistry test. Levels of blood urea nitrogen and creatinine show how well the kidneys are working. People with myeloma will have impaired kidney function. Low levels of albumin in blood can be a sign of more advanced myeloma. Calcium levels may be higher in people with advanced myeloma. There are two types of urine tests, which are Vance-Jones protein test and urine protein electrophoresis. Both of these tests are used to measure the abnormal immunoglobulins or M proteins found in urine. Abnormal levels of certain proteins may indicate myeloma. There are a few types of bone marrow tests. The first one is bone marrow biopsy, to see the appearance, size, and shape of the cells to determine if there are myeloma cells in the bone marrow. People with myeloma have too many plasma cells in their bone marrow. Next is immunohistochemistry and flow cytometry to look for certain substances on the outside surfaces of cells and to help determine if there are myeloma cells. Fluorescent in situ hybridization and cytogenic analysis is to find most chromosome changes. For imaging tests, bone X-rays are used to detect bone destruction caused by myeloma cells. CT scan is used to show any abnormalities or tumors in soft tissues and to diagnose whether the bones have been damaged by myeloma cells. MRI is more sensitive in detecting myeloma lesions and can find plasmacytomas that cannot be seen on regular X-rays. Good morning, King.
Good morning, doctor.
And Mita.
Good morning, doctor.
From the examinations that you have undergone, I am very sorry to inform you that you have been diagnosed with myeloma stage 2.
Oh my goodness, myeloma? What is that?
It is a bone marrow cancer.
Bone marrow cancer?
Yes.
But how is it possible, doctor, for him to get this cancer? He's a very healthy man.
Yeah.
Look at this muscle. Where's your muscle? This. How can this happen to him?
What is the cause of the cancer? I'm really shocked to hear this.
Well, actually, the most significant risk factor for multiple myeloma is age, as 96% of cases are diagnosed in people older than 45 years. And men are slightly more likely to develop myeloma than women. Besides, exposure to radiation may also increase the risk of myeloma.
Yeah. King works at nuclear power plant.
Yeah.
So he might be exposed to radiation there.
Oh.
Is there any other causes?
Yes, the likelihood of getting multiple myeloma is higher if a person is exposed to herbicides, insecticides, petroleum products, heavy metals, plastics, and various dust, including asbestos. Obesity also increases the risk of developing myeloma. Look at your BMI, it's 30. You are considered as obese. And for your further information, myeloma risk is 2.6 times higher in people with HIV or AIDS. People with other disease such as NGUS, which is monoclonal gammopathy of undetermined significance, have a higher risk of developing this cancer too. But in most cases, multiple myeloma develops in individuals who have no known risk factors. Back at home, Mita was very worried about King's condition, so she tried to find information from the internet regarding myeloma.
Hello, today we are going to learn about myeloma. This is a bone marrow. In the bone marrow, plasma cells are produced. Under normal conditions, plasma cells produces normal immunoglobulins, which are antibodies that help fight infection. Meanwhile, in myeloma, abnormal plasma cells produces abnormal antibodies, which are also called M protein or monoclonal immunoglobulins. These myeloma cells multiply abnormally, grow rapidly without any proper order, and form tumors that accumulate in the bone marrow. So, myeloma is actually a cancer of plasma cells that arises in the bone marrow. Thank you for watching.
Suddenly, Mita remembered that she had a friend who was a specialist in treating myeloma, so she went to meet her in a cafe.
Joey, do you know my boyfriend has been diagnosed with myeloma cancer? So I'm so worried about his health. I mean, he needs my support. He really needs it. And I suppose you know more about this cancer. Can you tell me about it?
Oh, Mita, I'm very sorry to hear that. Of course, I can help you. There is a video that I especially made regarding the staging and spread of myeloma. You should watch.
Okay.
Let us learn about the staging of myeloma. There are two types of staging systems used to determine the stage of myeloma. The first type is International Staging System (ISS) and the other is Uri-Simon Staging System. ISS work based on two test results, which are the level of beta-2 microglobulin and the albumin. Less than 3.5 of beta-2 microglobulin and 3.5 or greater of albumin level indicate the stage 1. Below are the indication of stage 2 of myeloma of ISS. For stage 3, the beta-2 microglobulin is 5.5 or greater. The Uri-Simon staging system works based on four factors. The first, the amount of abnormal monoclonal immunoglobulin in the blood or urine. The second, the amount of calcium in the blood. The third, the severity of bone damage based on X-ray. And the last, the amount of hemoglobin in the blood. The information below shows the indication for stage 1, 2, 3 of myeloma of Uri-Simon staging system. Now let us learn about the survival rate by stage. For stage 1, the median survival is 62 months. For stage 2, the median survival is 44 months. While for stage 3, the median survival is 29 months. So, what are the treatment options for myeloma by stage? The use of drugs such as bisphosphonate, lenalidomide, and dexamethasone are normally used for treating the stage 1 myeloma. For stage 2 and above myeloma, drug therapy, bisphosphonate treatment, chemotherapy, and radiation therapy are often used to treat the patient. Stem cell transplant may be also a part of treatment. There are some supportive treatments such as transfusion in order to treat low blood cell count. For the spread of myeloma, the most common bone that myeloma occur are spine, ribs, breastbone or sternum, and hips. That's all for now. Thanks for watching.
OMG! King only has 44 months to survive. So what are the treatment options for myeloma?
There are a few treatments that can be done. For example, chemotherapy, which uses the anti-cancer drug to destroy the cancer cell. However, there are some side effects from this treatment, which include the hair loss, mouth sore, loss of appetite, nausea, vomiting, and low blood count. The treatment like the stem cell transplant is also done after the patient get high dose chemotherapy to kill the myeloma cell in the bone marrow. So the patient will receive a new healthy blood forming stem cell. The new stem cell will come from the bone marrow. Corticosteroid can be used in a number of ways in cancer treatment. They can treat the cancer itself, reduce the sickness when having the chemotherapy, and reduce the immune response, for example, after having a bone marrow transplant. Then we have the using of drug called a bisphosphonate, which can help bone to stay strong by slowing down the weakening of bone by myeloma cell and preventing the further bone damage in myeloma patient. Then we have the radiation therapy, which may be used to treat the area of bone damage by myeloma that have not responded to chemotherapy and narcotic. But they have the side effect like skin changes in the area that being treated, fatigue, and so on. Surgery is sometimes used to remove the single plasmacytomas, but it is rarely used to treat the multiple myeloma. Then last we have the biological therapy, which are the drugs for therapeutic purpose that help to control the growth of myeloma cell. Intensive treatment of biological therapies is for improving the chance of getting a complete response, which is called a remission.
Sorry, remission? What does that mean?
Remission means that there is no sign of active disease in the body.
I see. Wow, thanks for your detailed explanation about myeloma, Jiahui. Now I can explain this and I can discuss with my boyfriend about the other treatment that can he take. Thank you.
After Mita discussed with King, King decided to do treatment.
Hey, doctor, I have decided to undergo radiotherapy and chemotherapy treatment.
Okay. Also, doctor, may I know the prognosis of King's disease after undergoing treatment?
Of course you may. It depends on myeloma cell growth rate. Cancer cells that grow rapidly will overtake healthy cells much faster. This leads to a poorer outlook. The prognosis also depends on the age of the patient, stage and extent of the disease, the biologic makeup of the tumor, and the overall health status of the individual. Certain chromosome changes or abnormalities may predict a poorer outcome. Besides, the outlook will be worse if your kidneys are unhealthy. You have to drink lots of fluids to help your kidneys function properly. Because of your weakened immune system, you also have to take care of extra precautions to avoid infections to lengthen your life.
So King, you have to take care of your kidney, yeah?
Okay.
Hello King.
Hello, doctor.
Hello Mita.
Good morning, doctor.
I am again very sorry to tell you that your boyfriend's myeloma has relapsed.
Relapse? What is that?
It means that the cancer returns back after a period of remission. Since multiple myeloma does not have a cure, it is likely that at some point patients will relapse. It is called relapse myeloma.
Oh my goodness, King!
His myeloma this time is refractory. It means that it does not respond to treatment after relapse. However, refractory myeloma patients often have a different drug added to the treatment regimen, or a different combination of drugs may be used as a second-line therapy. We can try for it.
Yeah, sure.
Baby, I can't take it anymore. I will leave you alone. I will give you my money, my house, and my everything.
King? No, King! Wake up, King! Doctor, what's going on? Oh my god!
Good evening, welcome to BBC News. Here we have Dr. Mita to share us some information about myeloma. So Dr. Mita, can you explain the incidence of myeloma based on different countries?
Okay, the highest incidence occur in Western countries like Australia, and the lowest incidence occur in Asian countries.
How about worldwide scale?
In worldwide scale, there are 8,000 incidents occurring annually, and also 63,000 subjects report die each year.
So multiple myeloma usually occur in what person?
Multiple myeloma is a common malignancy in patients above 45 years old in male, and also it counts for 1% of all malignancy and 10% of all hematological disease. Multiple myeloma and osteosarcoma combined account for approximately 50% of all primary bone malignancies.
Thank you Dr. Mita for her information. Now let's have a look at the screen. In Malaysia, the annual mortality rate is 0.6 per 100,000 people, and the annual year of healthy life loss is 14.4 per 100,000 people. In the aspect of sex, men have a higher annual mortality rate than women. This is shown by the annual mortality rate of men of 6.9 compared to annual mortality rate of women of 4.1 at the age of 70 to 74. However, at the age of 80 to 84, the annual mortality rate of women is higher than that of male. Overall, the annual mortality rate is increasing as the age increases. In the aspect of ASEAN countries, Japan has the highest annual mortality rate of 3.7 per 100,000 people, which is quite high compared to mortality rate at Malaysia, which is only 0.6 per 100,000 people, while for Kyrgyzstan has the lowest annual mortality rate of 0.1 per 100,000 people. In the aspect of other regions of the world annual mortality rate is 1.1 per 100,000 people, while the Southern Asia annual mortality rate is only 0.3 per 100,000 people. Thank you for watching. See you in the next breaking news. Good day.